Hi everyone, welcome back to my channel. If you're new here, hi, my name is Stephanie and I'm an internal medicine doctor in Canada. I make videos about health, wellness, as well as my life as a doctor. I hope everyone is doing well and staying healthy. Today's video will show you my experience as a doctor on call during the coronavirus outbreak. This is a real account of my real emotions in real time. So keep watching if you want to learn what it's like in a Canadian hospital during the coronavirus. So today is Tuesday. It is approximately 4:50 and I'm going to be starting my shift at the hospital tonight. I'm on a night shift for 15 hours. So I'm going to be taking you guys along with me to see what exciting things we find. Hopefully I'll have some interesting cases. I'll probably have a lot of COVID cases that we can discuss and we'll go from there. All right, this is my room. So much nicer than some of the rooms I've had in residency. We actually have a bed and a computer. All right, so here I am. I'm in my call room. It's kind of where I always start the night, where I've been waiting now for consults. I just got handover from the physician who was on during the day, and from what he tells me is there's quite a few people from nursing homes who are suspected to have COVID, and so it seems like the whole emerge is filled with people from the nursing home. So that's what we get to look forward to tonight, and we'll see if we get any other interesting cases. I always get my sheets ready, so these are sheets that I put together. Basically it says things like what's the consult for, what's the past medical history, what are the presenting symptoms, the physical exam findings like their vitals, and vitals again include heart rate, blood pressure, oxygen saturation, temperature, and their respiratory rate. And then I write down any investigations that have been done. So investigations are basically tests. So things that we do for patients is we do a lot of blood work. If there's been a chest x-ray done, then it goes there. And then my final column is for my assessment and plan. So after looking at their history, their presentation symptoms, their investigations, from my opinion, what do I think they have and what am I going to do about that? So am I going to admit them? What kind of treatment I'm going to do? And so I always keep this very organized on my paper so that when it gets late into the night and it's like 2 or 3 in the morning, I'm not going crazy and I can just refer to my paper in case my brain starts to get a little foggy at that time. So keeping organized is key, especially when you're on the night shift. All right, so I am all gowned up with my mask and my goggles. So these are what we're going to be wearing all night because we can't be quite certain which patients have COVID and which don't. Therefore, I have to wear this mask and these goggles basically the entire night. I just received my first consult, who is a patient with shortness of breath, cough, and a fever. Prior to seeing the patient, I always review their file on the computer in order to obtain some of their medical history, medications, and current lab work, as well as any investigations that were already completed by the emerge doctor. So I've also been referred a bunch more patients. I already did go and see one of our possible COVID patients, as she is an elderly woman in her 90s from a nursing home where there's actually been an outbreak of the COVID-19 there. So it is likely that she has it. Thankfully though, she's not on any oxygen. She just has a fever and a cough, but she's otherwise well. And what we normally do with these patients is that we admit them to the hospital. We do start them on antibiotics in the event that it's not COVID and there is a possible bacterial infection. So one thing that's very important with infections is that if it's a bacterial infection, giving antibiotics up front and giving fluids and things like that are very important to actually reduce mortality, and there's a lot of studies. So she's been started on some antibiotics. They did the nasal swab, and that will come back usually within 48 hours. It's actually quite quick in the hospital because obviously we need it more quickly. And then we'll see and we'll go from there. In my gut, she probably has COVID-19, but hopefully she'll do well. She seems to be well right now. And if she's well enough to go back to the home after a few days, once we know, then that will happen for her. I'm gonna do some dictations. So one glorious thing about being a physician and being in internal medicine is that after you see a patient and assess them and have a plan and everything, there's two things you have to do. One is admit them. And so usually that involves filling out an order set, like an admission order set. The second thing that I have to do is dictate. So we actually dictate using Dragon. So I dictate my note on the computer and it appears instantly. So when the physician sees it in the morning, they'll have everything that I did and they'll know a little bit about the patient so that they can just go and see them and assess them and see how they did. So one of the other jobs that I do while I'm staff and on call overnight is I actually get any calls or pages from the ward. So patients who have already been admitted, but maybe something happens overnight, either they can't sleep or they have some nausea and they need some medication, or I have to actually go and assess them. So I usually get these calls as text messages through my phone. I just received one and I'm going to call it back now. Hi, it's Dr. Oh, okay. Let's hold off on the heparin drip. Okay. And let's just give, and it was bright red blood, it wasn't, actually, I'll come and see him. All right, so I just got a call about a patient who was admitted to the floor. He actually is a COVID positive patient, but he has a different problem. So he has a blood clot and he was on a blood thinner for that. And it looks like he's just had some bleeding now from his bum. So some rectal bleeding. So I'm gonna go assess him. I'm gonna see if he may need some other medication, but I'm gonna go see him now. So I'm all suited up, ready to go to see the patient. So I did go and assess that patient. He was actually a patient who came in with a GI bleed, or a bleed from his colon. So he actually had blood in his poop, and he had just been restarted back on a blood thinner because of a clot. So we have a bit of a dilemma here. So whenever someone's bleeding, despite the fact that they have a clot somewhere, we have to stop the blood thinners. Otherwise, they're just gonna bleed more. So he's very stable right now. So I did stop his blood thinners and I'm gonna recheck his blood level, which is his hemoglobin level, to see where we're at. And if it's dropped significantly, and usually our cutoff is below 70, then he may require a transfusion. Hopefully not, but we will wait and see what the blood shows. All right, guys, so it is currently 4:30 in the morning. Just received the blood work back for that patient who is bleeding. His hemoglobin did drop, but it's not enough to require a transfusion. So I've asked the nurse that we repeat his blood work in another few hours. We'll add a group and screen. So basically, if he will require a transfusion, we always screen the patient's blood type. Because as you probably most of you know, is that you want to get the same type of blood that you are to prevent any reactions or allergic reactions and things like that. He's overall very stable, so the issue is going to be now is that he can't be on anticoagulation, at least not now. He can't be on the blood thinner, that is, because he will likely bleed. And so the real problem now is he's had this lower GI bleed, so there might be something in his colon that's been bleeding. They weren't going to scope because this patient is COVID positive right now, but that may need to be reassessed if he continues to bleed every time he's put on the blood thinner. So not an issue that we're going to figure out tonight, but as long as the patient's stable, I'll check up on him, and hopefully that'll be it for tonight. Some other interesting facts about today. So on average, we can see between, I think the lowest I ever saw here at this site was maybe 7 patients, and then the most I've seen is about 17. And one thing that's different between being in the community versus being in a hospital where there's tons of residents is that if it's just me on call, I see all those consults. Whereas if you're in a bigger hospital where there's a team, you can share. I mean, the senior has to see them all, but at least you know that there's a junior to look after, and it's a bit different that way. So What I've learned over these last few months is that I have to be fast, because obviously I have to be a bit quicker than when I was a resident, given a lot more time. Sometimes you're given a couple more hours. So really time management is key, and also being organized, which I think I've been able to accomplish, so that's good. Otherwise, the volumes can fluctuate. So we are going through COVID-19, and I have noticed that the volumes are low, at least in Emerge. There's less patients in the hospital, so when I was admitting the patients to the teams, usually each team can be anywhere between 25 to 40 patients, and I know it's quite a big range, but I've had at least even 42 patients for one doctor alone, which is a lot and is a little bit overwhelming. But the numbers here are between like 15 to 25. The biggest list, or the largest number of patients, is on the COVID floor, because we do have quite a few, and they're all being admitted to one floor under one doctor so far. So that's the biggest team. But otherwise, there was actually empty beds in Emerge. It's kind of crazy that people are not really coming for other health problems, which is good and bad. Good because obviously it opens up the beds for other people, but bad because just because we are going through this pandemic doesn't mean people still don't have heart attacks or have other GI problems or other issues. So it makes me wonder, like, I know everyone's trying to avoid going to the hospital, but it's also a little bit scary because they may end up coming when they're really, really sick, as opposed to if they were less sick and they would have come earlier on a normal situation. But we will see. Hopefully things will still remain controlled. It's still crazy here. I've never had to wear a mask and goggles all day, or all night that is, and I just can't. I don't know, it was very difficult at one point. Like, it's just your face is all dented, and I think I still have a dent on my face, but at least I can take it off while I'm trying to rest in my room. But as soon as I go out, I have to put everything back on. The other issue is that we only get one mask, we get two masks, so I do have my second mask still, but in a normal situation, we would be changing our mask and throwing it out after every patient who requires droplet precautions. But because there's such a shortage of PPE, which is personal protective equipment, we actually have to wear the same mask, and we're not supposed to touch it or take it off for multiple patients. And then we're actually supposed to put our masks in a special bin to possibly be recycled if they can clean them. We don't know if that can happen yet or if that's going to happen, but we hope we don't get there. So I'm obviously being very careful with my mask, my goggles, which I'll have to disinfect after when I go home later this morning. But it's a little crazy having to really keep all of these things under control. Alright guys, it is currently 8 o'clock. I'm just outside my house and I've made it. I'm very tired right now, but I think that we had a lot of interesting cases and very much of a perspective. I hope you guys like this vlog. If you did, please comment below and give this video a thumbs up, as well as subscribe to my channel. I will probably be doing more vlogs in the future, and I'm hoping to incorporate some other things too. So I really hope you guys liked it. I'd love to hear from you with any suggestions about anything else. Bye guys, stay safe, be healthy, see ya.